Hi, I'm Brianna. I'll be your student nurse today. Can I just get your name and date of birth?
Yeah, it's Joshua Schultz, June 29, 2004.
Perfect, that checks out here. So today we're going to be doing an assessment of your lungs and your chest and then your upper and lower extremities, your arms and legs. So I'm just going to start off with a few questions. Do you smoke?
No.
Do you have any chest pain?
Nope.
Any shortness of breath at all?
Nope.
Perfect. Check. I'll document all of that. So we're going to start here with the lungs today. So if I could just have you remove your shirt, please. Thank you. So I'm just going to start off looking at your chest, making sure your breathing is equal bilaterally. Making sure your chest is expanding, looking at the AP to T ratio, making sure it's 1 to 2, which looks great. So I'm just going to go ahead and feel your lungs, okay? If I could just have you take a deep breath. Perfect. They're expanding bilaterally. I'm going to do that to the posterior too. I'm just going to feel for your lungs. And a deep breath. Perfect. Everything looks good there. So I'm just going to go ahead and listen. At each point, if you could just take a deep breath in and out through your mouth. Deep breath. Perfect. Everything in the front sounds good. Everything was bilateral, no abnormal breath sounds. So I'm just going to do the same for the back, and again, just a deep breath in and out through your mouth. So everything sounded normal there, which is good. So I'm going to move on to your cardiac assessment. So again, I'm just looking at your chest to make sure I can't see any visible pulsations or thrills or thrusts or anything like that. And then I'm just going to feel for each site. So I'm going to feel the aortic, pulmonic, Erb's point, mitral, and apical. Perfect. Everything looks good there. So I'm going to go ahead and listen to your heart. So if I could just have you lay back. So again, I'm just going to be listening at every site. Nothing special for you to do. I'm going to be listening with both sides of my stethoscope too. So we're going to start with this. Flip it over. Go again in with the bell. I'm gonna listen here for a minute. Perfect. Got your pulse as 64. So you can go ahead and just sit up. We're all done. You can go ahead and put your shirt back on too if you'd like. So next we're just going to be taking a look at your arms and legs and make sure there's no swelling or anything. Yeah, if you just throw them up, yep. So I'm just going to look at your arms and make sure there's equal color distribution, hair distribution, stuff like that. I'm also going to feel for temperature. Perfect. And then I'm just going to feel for swelling. Good. Can I check your fingers? No clubbing. I'm going to check your cap refill right away too. Perfect. Other hand. Again, no clubbing. Check the cap refill. Perfect. And then I'm just going to feel for your radial pulses. So just arms relaxed. And those are bilateral 2+. Everything looks good there. You can put your sleeves back down if you'd like. I'm just going to check out your legs. I'm going to put this out if you can. You can lay back if you want, whatever's comfortable for you. So again, I'm just looking at the legs to make sure there's equal color distribution, hair distribution. Everything looks good there. Again, I'm just going to be feeling for temperature. Feels good. And then I'm going to feel for swelling. Swelling. And then I'm going to feel your pulses. So I'm going to feel the posterior tibial pulse. Perfect. That's equal and bilateral, +2. And then I'm going to feel your dorsalis pedis. Also equal and 2+. Perfect. Everything looks good. Do you have any questions for me at all?
Nope.
Perfect. Your Beretta will be in just a couple minutes, and I'm going to go document. Alrighty, so then I would document that breathing was quiet and effortless at a rate of 14 breaths per minute. Skin and nails were appropriate color for individual's ethnic background. Thorax was symmetric with ribs sloping downwards at about 45 degrees relative to the spine. Thoracic expansion was symmetric bilaterally, and AP to T diameter was 1:2 ratio. Trachea was midline, breath sounds clear with vesicular breath sounds heard over most lung fields, bronchovesicular breath sounds in posterior chest and upper center area of back and around the sternal border. Bronchial breath sounds were heard over the trachea. Skin was warm and dry with uniform pigmentation, no clubbing of fingernails, no visible heaves or pulsations noted on anterior chest, no thrills or pulsations at aortic, pulmonic, tricuspid, mitral, or Erb's point. The PMI was located at the fifth intercostal space, lateral to the midclavicular line. Patient was lying superior. Apical heart rate was 64 with regular rhythm. S1 and S2 heard at aortic, pulmonic, tricuspid, mitral, and Erb's point. S1 was loudest at mitral and tricuspid points, and S2 was loudest at the aortic and pulmonic points. No S3 or S4 sounds were heard, no murmurs or extra heart sounds. Extremities were pinkish without redness, cyanosis, or any skin lesions. Extremity size is symmetric without swelling or atrophy. The skin was warm and dry bilaterally, upper and lower pulses all present, 2+ and equally bilateral. Capillary refill was less than 2 seconds bilaterally. Pulses were regular, rhythm equal 2+, no lesions, edema, varicoses. The toenails were clear and pink, and patient did not have any chest pain, wasn't a smoker, and did not have any shortness of breath.